is not to be seen in the market anymore. In many cases, the pre-torque bracket do work well, but in many cases, the built-in torque is not enough or can be too much. Then the students still have to learn how to bend the wire to be able to solve some difficult case. For example, extraction case in which maxillary's anterior teeth tend to be over-retract, or in severe class 2 division 2 cases which needed an extra torque. The posterior torque. The buccal-palatino root position can be controlled by the third order bends torque in the posterior segment of the arch wire. Like the anterior bracket, in the first generation of the edgewise appliance, there were no tip or no torque built into the premolar bracket or a molar buccal tube. The slot will be cut in the middle of the bracket or tube perpendicular to that basis. When a bracket or a buccal tube is based on the labial surface of the posterior teeth, the slot will not stay in the horizontal plane, but it will form an alpha angle to the horizontal plane. When an arch wire which lies flat in horizontal plane is engaged into the buccal tube, it will create a buccal crown torque, palatino root torque, and the palatal cusp will hang down, which is sometimes an unwanted effect. This is figure number 20. In order to maintain the original inclination of the tooth, one has to bend negative torque into the arch wire, which will make an alpha angle to a horizontal plane. When the arch wire is engaged into the buccal tube, and there will be no tooth movement. This is called the passive engagement. Figure number 21. When torque was bent into the arch wire with a greater than an alpha angle to the horizontal plane and engaged into the buccal tube, the crown and the root will move in different directions. That is, palatal crown movement and the buccal root movement will take place, which will be used to eliminate the hanging down of the palatal cusp of the molar teeth. Teeth in the posterior segment will need progressive increasing torque starting from the canine area to the second molar. For example, from 0 to minus 25 degrees. Decision has to be made when the situation in the mouth is seen. Then this is called the progressive torque. In modern straight wire appliance, the posterior torque is built in the premolar bracket and the buccal tubes, and this can be torque in the face or torque in the base. And in my opinion, it does not make any differences. In many cases, the pre-torque appliance do work well, but in many cases, the built-in torque is not enough to produce good results, or it can be too much. Then, the student must still learn how to bend the progressive torque to be able to solve some difficult cases. For example, number 1, in extraction cases, the dental arches tend to constrict. A compensatory expansion and more buccal root torque must be added. Number 2, in the treatment of the dental crossbite, where expansion in the arch wire is needed, more buccal root torque will be added. Number 3, where compression in the arch wire is needed, more palatal root torque must be added. Next, in the mandible, A, the anterior torque. Normally, we do not add any torque into the bracket. The bracket we use nowadays has minus degree torque. This is to upright the mandibular incisor on the apical base. B, the posterior torque for the mandible. This is the same. The mandibular teeth in the posterior segment have lingual inclination. For proper occlusion, it will need progressive increasing of torque starting from the canine area to the second molar area. For example, from 0 degree to minus 25 degree. Decision has been made when the situation in the mouth is seen. This is called, also like in the maxilla, the progressive torque, as seen in figure 23. In the practice, when an end of an arch wire with torque is inserted into the molar buccal tube on one side, the other end lies next to another molar buccal tube of the contralateral side. This means that the torque will produce no crown movement. Now we come to the third order bends. The most common bend is the maxillary front torque. There are two techniques in bending the torque. We use two tweed archwire bending pliers. At first, we will have to mark at point 2A and 2B. Here we bend the canine out bend. Turn the wire 180 degrees. Bend the canine out bend and curvature. Now we're done. The next step, we bend torque direct in this segment, anterior torque. What I recommend is use the right plier and hold the right plier steady before point 2B. And another plier come from inside and stay about 1 millimeter apart from the right plier. And the plier will stay as the radius of the anterior curvature, as seen here. And then we turn the left plier 15 degrees down, as seen here. And on the A side, we clip the plier just in front of the 2A. And the left plier come from inside and stay about 1 millimeter apart from the right plier. And when you hold the right plier steady and twist the left plier down 15 degrees. Your wire will stay flat on the table with a small elevation called a half moon in this area. This is the first step to bend the direct technique. And then we have to eliminate the half moon as shown in page 35. We will start this bending by traveling and bending. We start at the point 2B. We will push the wire up, and slide the plier along the anterior curvature. As we push the arch wire up, and up, and you will see that the half moon is disappear. The wire has no elevation. If this is not the case, you have to repeat the process one more time, and then you will see arch wire lie flat again on the table. If you check this is the posterior segment, you see no torque. At the canine area, no torque. But in the lateral incisor area, you start to see the torque in the wire. Torque. The whole anterior segment is receiving the torque. I'll turn the plier slowly so you can see torque in the front, torque in the wire. Now, at the canine area, there's no torque. This is called zero torque. Next, we will bend the anterior torque with the indirect technique. We started the same thing. We marked our archway at point 2A and 2B. Why we call this indirect technique? Because first, we bend torque in the posterior segment and then we transfer the torque into the anterior segment. Torque in the posterior segment is negative, but when we transfer to the anterior, to the front torque, it will be positive torque. We'll start at the point 2B first. We grip the tweed plier with the right hand distal of the point 2B. And the left plier from inside, 1 millimeter away from the right plier. This time we hold the left plier steady, but we turn the right plier 15 degrees down. This will create a continuous torque in the posterior segment and no torque in the anterior segment. Same thing we do on the side A. With the right plier, we grip at point 2A and the left plier 1 millimeter away from point 2A. Now, we hold the left plier steady and twist the right plier 15 degrees down. And now, we will have torque in the posterior segment, no torque in the anterior segment, torque in the posterior segment, and no half moon, as seen here on the table. No half moon. We have to bend elimination of the half moon bend. This is to transfer the torque from the posterior segment into the anterior segment. The elimination of the half moon bend is on page 36. We will travel from point 2B to 2A. We slowly press the anterior segment up. As we move, the right plier travel along the anterior segment. And then you can see that the torque is transferred slowly into the anterior segment and no half moon. Now we can check there is no torque in the posterior segment, but there is torque in the anterior segment. The torque has been transferred from the posterior segment to the anterior segment. If you grab at end point and see it with one eye from the side, you will see one arch, one single arch with the torque in the anterior segment. I'll move up like this. The torque is first bent in the posterior segment and then transferred to the anterior segment. That's the reason why we call it indirect torque. For example, we have a contraction arch wire with two L loops. It's impossible to bend direct torque into this segment. So we will have to use the indirect technique. We use gyrobuck plier. We grab the gyrobuck plier just mesial to the loop, and then we push the loop 15 degrees outside. This is just like twisted with a tweed plier. At 2A, same thing. We twist the loop 15 degrees outside. So now, if we check the torque, we have torque in the posterior segment, as seen here. We have no torque in the anterior segment. But we have torque in the posterior segment, as seen here. So we want to transfer the torque from the posterior segment into the anterior segment. So we have to bend the elimination of the half moon. From 2B to 2A, we slowly press the anterior curvature up and travel at the same time along the anterior curvature. And you can see that the contraction loop is uprighting itself slowly back to the vertical plane. And now we have torque in the anterior segment and no torque in the posterior segment. No torque in the posterior segment. Minor adjustment will be needed. Okay, again one more time. We have no torque in the posterior segment. 0. And we have torque in the anterior segment. This is a little bit exaggerated. It should be something like 15 degrees. Now it looks better. Torque in the anterior. And no torque in the posterior. The next is maxillary posterior torque. We need to do the canine outbend first, canine curvature, and the posterior curvature. And ready to make torque in the posterior segment. On B side, same thing, canine curvature, posterior curvature, and we must take good care of the arch form. Do not lose the arch form. To make the posterior torque, we start with middle of the canine on the side 2B. We use the second tweed and coming out from the outside. We hold the left tweed steady and twist the right tweed outside approximately 90 degrees and let go. Slip the left plier close to the right tweed, slip the right tweed out and twist another 90 degrees. So we will have approximately 20-25 degrees of progressive torque. Starting from canine, 0 torque, torque is getting more and more and more and more. And this is torque for the second molar. Same thing, we do it on the right side. We hold the left tweed steady.